Hi, this video is the art of hair transplant restoration surgery on a black African man. He actually flew in all the way from England. I mean, not England, France. So this client flew all the way from France for me to restore his hair. I have clients not just from France, but from Germany, England, and Dubai, Saudi Arabia. The most important thing is most people who seek me out is because I'm a specialist on black curly hair using the strip method or the FUE method. But the FUE has revolutionized the hair industry and allow more black African men with curly hair to do a hair transplant because they leave tiny dots of scar scattered throughout back like a mosaic pattern, allow you to wear your hair shorter. Because you don't want the strip method or the older method, you leave a linear scar and you will never be able to wear your hair short. And the scar is permanent and it cannot be changed. So instead of having a linear scar, the tiny dots of scar by the FUE method is a more preferred way. But the strip method is still being used, and I do the strip too, mostly for the client who lost all the hair. The benefit of the strip of the FUE is you can move a large number of grafts per day, like 4,000 or 5,000 grafts a day, until you achieve front and back in one sitting. But where moderate hair loss, FUE is the best technique. Through many years' experience, I invented the technique called the DFC technique. It's the Diep FUE Curve technique. It's the most advanced FUE technique where it predicts where the curly root lies and go in a precise angle and harvest it out. Because where the hair exits with the curly root, it can lie to the left, right, or any position. So my technique will predict where it lies. And this client, he has a receding hairline and the temple. So I'll go to do around 1,500, around 1,800, 1,500 around here, and then 150 around both sides. Just depend how big it is. Sometimes you can go up to 2,000 if you need to. It's just the lower the hairline, the more density it needs, the more hair it needs. And then on average, from the mid-eyebrow to the hairline is around 6.5 to 7 for Asian and black. For Caucasian, around 7.5 to 8.5. And most black hairline is pretty much straight curve across, where Caucasian men is like curve up. And again, I use the average height of each ethnic as ethnic height hairline as a guide, but when you build a hairline, you build it according to each individual facial structure. From mid-eyebrow to the hairline is a third, mid-glabella, tip of the nose a third, tip of the nose, bottom chin is a third. And then, once we get this shape down, we not only fill in up to the ball area, we'll go up high to reinforce the existing area, so we blend it in, so less chance of demarcated line. As you know, the tempo is being brought in for this client, 150 to 200. And for Caucasian men, the angle of tempo is most acute backward, Asians less. For black men, it's straight perpendicular. And again, same thing like this side. Again, we're trying to do straight perpendicular. And for all ethnic, for black, the tempo is very important because the tempo really bring in make the head smaller and really frame the face better. And so we not lower the hairline, but if we don't bring in the tempo, you're gonna have a really wide forehead. So bringing the tempo is really, really important. Once we get the shape down, we will transplant at a very flat angle, around 15 degrees, and changes when you go a different direction. For the angle of the tempo is flat and pointed backward. And the selection of hair, not only precise angle is important, selection of hair graft is important. We transplant rows and rows, single hair graft in the front, followed by the root to go 2 hair, 3 hair, 4 hair in the back for bulk and volume. And most of the tempo I use root a single hair. Now, the zigzag for black men, African men, is a smaller when you compare to other ethnic like Asian, Caucasian would have bigger amplitude zigzag. Why? Because most black African men like to line the hair up anyway. So if you do such a big zigzag, then the hairline can be a lot higher. So we tend to do a smaller zigzag. So that's why you can line up and the hairline is still down where the level it should be. I'm very excited for this client. He flew all the way from France for me to do this surgery using the FUE method. It's an honor, and we'll try our best. And in a year's time, he will look completely different with a lower set of hairline and frame his face better. And of course, he's gonna need more for the crown. So today we just focus for the frontal area. Thank you.